I'm Gene Liu, and I'm an otolaryngologist, head and neck surgeon, or ear, nose, and throat doctor here in Los Angeles. I've had the privilege of operating on thousands of children over my career, and I get asked all the time by parents, what should I tell my child about their surgery, and what can I expect on the day of the procedure? There isn't one way to handle how much to tell your child. It's going to depend on their age, their maturity level, but how much exposure they've had to healthcare before. So if you have a child that's been through the emergency room multiple times for asthma, they're either going to be much calmer about the process of going to the hospital or the operating room, or they might freak out even more. It really depends, but at this point, if that's your child, you probably already know how they're going to react. Because I'm an ear, nose, and throat doctor, I'm going to use an example of a 3-year-old undergoing a tonsillectomy. Most 3-year-olds are not going to remember or understand what you tell them about the medical procedure or what a tonsil is. At that age, I would basically focus on the fact that they're going to go into the hospital, they're going to meet their doctor, go to sleep, and when they wake up, they're going to get lots of ice cream. Any more detail than that, they're not going to understand or remember. If we use the example of an 8-year-old undergoing a tonsillectomy, they probably have enough ability to understand what a tonsil is, why they've been having sore throats, so you can get a little bit more into the detail of the fact that you're doing something to make them better, that they're going to go through a surgery, they're going to have a sore throat when they wake up, but they're going to get through it with lots of ice cream. Definitely don't forget to tell them about the ice cream. For preteens and teens, they're basically going to want to know as much as adults do. Although there are some adults who are really anxious and don't want to know much around their procedure, it's probably a good idea to discuss the risks, benefits, and alternatives to the procedure with these children. At the end of the day, even though the parents are the ones providing consent for the procedure, it's important to get the teenager or preteen's assent, A-S-S-E-N-T, as well. At any age, you want to be reassuring about everything you say. You want to focus on the positives, what they're going to get out of the procedure, why it's going to make them better. Definitely validate any feelings of anxiety or fear that they may have about it, and make sure they understand that this isn't about any punishment for anything that they've done. A good idea is to try to make it as fun as possible. Turn it into a game, a little bit of an adventure. One way to kind of alleviate some of the fears and concerns is to go to some tried and true resources like Curious George Goes to the Hospital. If they see some of their favorite characters go through a similar process, it sometimes will be reassuring. It is also important not to get lost in the situation and take care of yourself. You want to make sure that you get plenty of rest where you can, talk to people who've gone through it already, go to family and friends or your network or resources to talk about any stress that you may have. But it is important not to let on to the children too much of your anxieties. It's only going to feed into theirs. Now it's the day before surgery. The most important thing is to adhere to the NPO or nil per os guidelines. It means nothing by mouth. In general, you're not supposed to have anything solid 8 hours before, any formula 6 hours before, any breast milk 4 hours before, or any clear liquids 2 hours before. It is very important to follow these guidelines because we don't want anything in the stomach when the child is going to sleep. When someone is given anesthetic, it tends to relax some of the sphincters in the GI tract, and it can increase the risk of stomach contents coming up, getting aspirated into the windpipe and lungs, and creating potentially life-threatening pneumonias that can land you in the ICU on a ventilator. The numbers that I gave for the NPO guidelines are the general guidelines. There may be some variability based on the institution, the surgeon or the anesthesiologist, and the nature of the surgery and any medical conditions your child may have. So please make sure you go over this with your surgeon. Now you're finally at the day of surgery. You're going to be waking up ridiculously early. You're going to be disrupting your entire feeding and sleep cycle. It's going to be a rough day. And generally, you're going to have to check in 2 hours early, kind of like going to the airport. Once you get there, you're going to have to clear check-in, TSA, get to the gate. Once you get to pre-op, think of that as the boarding area before you get on the plane. Within pre-op, you're going to meet the nurses, you're going to meet the anesthesiologist, and any other members of the care team. Just like at the airport, there can be a whole bunch of different reasons why there may be unanticipated or unexpected delays that are completely out of your control or your surgeon's control. For this reason, I recommend bringing an iPad, a device, a book, toys, certainly a favorite stuffed animal or blanket to keep the child calm and distracted if there happens to be a reason for delay. Once everything is ready, for small children in non-emergency surgeries, we almost always take them back to the operating room, give them a mask to breathe through, and drift them off to sleep. Any IV or breathing tube or other interventions are done after they're asleep. Occasionally, in older children, or certainly in emergencies, an IV is much more likely to be placed in advance in the pre-op area. The IV is the safest way to give fast rescue medications if anything should happen. This usually is done for safety reasons if needed. At the moment of separation from the parents, there understandably can be some anxiety. The longer that process drags on, usually the more anxious the child gets. They can pick up on what's going on around them. For this reason, I like to make the separation as fast as possible. The less time they have to think about it, and the faster you start going down the hall, the better. In general, I call it daycare drop-off. They may put up a little bit of a fuss, get a little bit worked up, but as soon as they turn the corner and can't see the parents anymore, they are almost always calm. Once we're in the operating room and they get the inhalational gas, they almost always drift off to sleep within 2 or 3 breaths. The added advantage of the anesthesia is that they don't remember the moments before going to sleep. They don't have any recall of the separation, going down the hall, or being in the operating room the vast majority of the time. Parents always assume that their child is freaking out without them. The reality is, almost always the kids aren't even crying. On occasion, to make that separation a little bit easier, the anesthesiologist and surgeon may decide that Versed, a Valium-like medication, should be given in the pre-op area. It's usually in the form of a drink and kicks in after 5 or 10 minutes. It can make the child very groggy and kind of take the edge off of the whole process. Ultimately, a lot of times, this can help with that separation, but it is another drug that needs to wear off at the end of anesthesia. It's not something that's always given. There are some advantages and disadvantages to giving Versed, so it's something that definitely should be discussed between the surgeon, anesthesiologist, and the parents. I just finished a lineup of 8 children today between the ages of 2 and 8. Not one of them needed the oral medication to sedate them before, and not one cried going back to the operating room and going to sleep. And that's a pretty typical day for me. Once the surgery is over and we get to the recovery room, we try to get the parents in as quickly as possible. Most of the time, parents walk in, the child is still asleep. But on occasion, the child may be sitting up, talking, even crying. The child is not going to remember any of these moments. For all intents and purposes, you're there when they wake up. When children wake up in the recovery room, they usually go through a 10 or 15 minute period of what I call the angry drunk. During this time, their head may be swimming, they may be hungry, there may be a little bit of a discomfort from the procedure, but they're not going to remember any of it. It's going to feel like an hour because all of your normal comforting and soothing methods may not work, but it always blows over and they never remember it. We've all seen videos of these super happy, giggly kids as they come out of anesthesia. That usually is much later in the recovery process, not right in those first few moments when they're waking up. On rare occasion, we will have a happy drunk right off the bat, but I wouldn't bank on it, but if it happens, we'll take it every time. At the end of the day, nobody wants their kid to have surgery. It's anxiety producing, it's stressful, but keep in mind we're always doing it to make them better. Kids ultimately are always going to be much more resilient than adults. They recover a lot faster, psychologically, emotionally, physically. They get through it a lot better than us old folks. I hope this answers some of the questions about how to address the surgery with your child beforehand and what to expect as you go through the surgical process. If you have any additional questions, please leave it in the comments below.